Let's talk about castor oil. First of all, there is absolutely nothing new about castor oil, despite what you may have seen with health influencers and TikTok videos. Castor oil has been around for centuries. Most people know about it from their grandmother or their great-grandmother who had a bottle in her medicine cabinet and used it as a laxative. And quite frankly, it works really good as a laxative. But now, TikTok and wellness blogs are pushing all new exciting uses, putting castor oil in your belly button, for instance, to flatten your stomach, fix bloating, and even help with menstrual cramps. And let's not forget the castor oil gallbladder cleanse. I'll mention my patient about that in a minute. So is this science or is it just another social media gimmick? Let's start with the belly button trend. Now, this practice is sometimes called the Patti method in Ayurvedic circles. Now, the claim says it helps digestion, menstrual cramps, inflammation, weight loss, even glowing skin. And it's based on the claim that the navel, your belly button, is a central hub where supposedly 72,000 nerves all come together so that oil there can spread benefits throughout the body. Now, here's the problem. This connection of 72,000 nerves has never been identified in modern anatomy. It is true that the umbilical cord enters your body and funnels blood through your liver and your circulation while you're a fetus inside of mom, but that connection is severed, obviously, at birth. And if there were important connections, they're long since gone. Now, as a heart surgeon, I was a general surgeon before I could become a heart surgeon. And I can assure you I've operated on or near and through many belly buttons. And there is an old ligamentous connection between the belly button and the liver. We can see it, we can cut through it, we can do anything we want to it, but there's unfortunately nothing there but ligamental scar tissue, not 72,000 nerves. If there were, then when I sent a specimen of the umbilical connection, the pathologist would say, wow, there's a lot of nerves in here. Nope, there aren't. So what do we know about castor oil? It was used as far back as ancient Egypt. It was used for skin care. It was used to treat wounds, and it was promoted for digestive health, primarily to keep bowel movements normal. It is FDA approved today as an oral stimulant laxative. And as I mentioned before, it really works as a laxative. Now, what about putting it on the skin? Well, it does have antimicrobial and anti-inflammatory properties, and it can improve skin hydration, no doubt about it. Now, some people also use it as a pack for comfort or relaxation. Absolutely nothing wrong with that. But there's really no hard clinical evidence that putting castor oil in your belly button has any systemic benefits. How about promoting a flat tummy and bloating? Sorry, there is absolutely no clinical evidence that belly button oiling reduces gas or drains lymph. What about menstrual cramps and endotoxemia? Well, there are anecdotes. There are anecdotes for everything. And just remember, the placebo effect is incredibly powerful. If you believe a treatment is going to work and is going to do what is claimed it's going to do, a lot of times that will work. That's called the placebo effect. And just because we have someone's report about how their menstrual cramps went away by putting castor oil on their belly button, that didn't mean that putting the castor oil in their belly button was the cause of the menstrual cramps being alleviated. Let's keep that in mind with all of these modern remedies. It's not a magical pathway, and it can't, and there's nothing wrong with the placebo effect. We use the placebo effect all the time to good use. How about weight loss? Well, drinking castor oil will produce weight loss. You have about 4 to 5 pounds of stool in your body at any one time. So getting rid of that 4 to 5 pounds with an impressive laxative will impressively cause a 4 to 5 pound weight loss. Works every time. But that's not real weight. That's just flushing out all of your gut buddies, which doesn't sound like a very good idea. So that's not safe weight loss. You see so many of these weight loss teas using the exact same effect. They'll use a diarrhea-producing agent like Senna or Senokot, which is in most of these miracle weight loss teas. And of course, you're going to lose weight when you use them because you got rid of that 4 to 5 pounds of gut buddies. How about skin benefits? Well, there's no harm of putting castor oil on your skin. It does moisturize. It can calm irritation. That part at least makes sense. Now, let me tell you my favorite gallbladder cleanse story. If you follow the internet, you know that putting a castor oil pack over the right side of your abdomen, where your liver is said to make you pass gallstones. Fair enough. One of my patients did the castor oil gallbladder cleanse, and she swore she passed giant gallstones and actually brought in the photos of what she claimed were in her stool to prove that these were giant gallstones. Now, I mentioned that I was a general surgeon before I became a heart surgeon, and I've taken out many gallbladders. I've explored many common bile ducts, the tube leading from the gallbladder to the intestines. And the photos of the gallstones she showed me, they were about the size of a golf ball or a shooter marble. And unfortunately, the gallbladder duct is only about the size of the tip of this pen. Yes, gallstones can get stuck in the gallbladder duct, and we have to operate them because they can't get through. So what she's claiming that castor oil did was taking this and expanding it to that so that that big gallstone could pass through that duct. And unfortunately, that can't happen. So she was not passing gallstones from her gallbladder. And whatever she passed, it wasn't gallstones. But the good news is it didn't harm her at all. So if you think that something is going to benefit you, go ahead, but you're not going to pass gallstones the size of a golf ball. Topical use. Whenever you're using any new topical treatment, do what's called a patch test. Put it on some place that's not too visible, particularly a sensitive area of skin. Oh, sometimes on the backside of your arm or the inside of your leg. And do a small area first just to make sure you're not going to get an irritation, because you never know what's going to irritate your particular skin. Finally, in oral use, it is a laxative, so buyer beware. It can produce dangerous cramping. It can clean you out very effectively. And remember, it's not a recommended treatment for contractions of pregnancy. We just don't know the effect on a fetus. So that's not something you want to play around with. Okay, castor oil, been around for a very long time. Putting it in your belly button isn't going to hurt you, but it's probably not going to do any miraculous things besides a great placebo effect. And it's not going to move your gallstones out of your gallbladder. Sorry about that. If you want to use castor oil, think about skin and comfort, but if you really need it, it's great blasting powder for your intestines, but used with caution. More amazing episodes just like this one. Watch now. Avocados are rich in fiber. Fiber is what feeds the good gut bacteria.